Hi guys, it's Dan here and we're going to start our next part of our correcting low back pain, hip pain, knee pain, that lumbopelvic hip dysfunction. Okay, so ideally, hopefully you've done the assessment process. We did that first video to see if we had those signs or what signs we had that were indicative of that dysfunction. So that's going to be that knees bow. You did that over a squat and you had those knees bow in, knees bow out with the heel rise still there. So you did the heel rise, knees bow in was still there, knees bow out was still there, didn't go away. You had arms, so you had you have your arms up, but then you put your hands down and you notice that anterior pelvic tilt, that excessive curve in the lumbar spine, that lower back region, didn't go away. So you put the you put the hands down, it was still there, didn't go away, we still got it. So just to give you guys a recap. Okay, imagine my heels are elevated on that half foam roll. You do your squat, you're still getting that knees kind of collapsing inward, so your knees are going, you know, inward of your second and third toe, or you had that knees bow out, so now they're on the outside of that second and third toe. Looking from the side, you had that excessive arch of the lumbar spine, that lower spine, got that excessive curving right here. And then you put your hands down and squat it, and it was still there. It didn't get any better, it didn't go away, it was still there. Okay, so they're all signs that's all indicative that those signs, or if you have any pain or dysfunction, it's coming from this region, that hip, pelvis, spinal, lumbopelvic hip complex, as we define it, as we call it. Okay, so if that's the case, then hopefully at this point you've done your release techniques for those muscles that we identified as being short and overactive. So that was our hip flexors, that was that TFL muscle that kind of sits in that front pocket area, that rectus femoris. So that's that quad muscle that's kind of down here. We did those releases, and we also did those inner thigh muscles, those adductors as well. We released those. I know we did some hamstring release. I spoke about why we do that, and we did some piriformis and some piriformis release. And again, those last two, if we had those knees bow out, which I spoke a bit more about in those videos. So, and again, we're also going to be looking. We also did those lat muscles, those big muscles on our back. We released those again, because if you did your hands on your hip or on your pelvis, and that lumbar and that anterior pelvic tilt got better, that's a sign that it's actually coming from that those lats are causing that. Okay, so hopefully at that point you've identified that, you've done your release techniques, the ones that are necessary. You've then done your mobility technique, so you've done that hip mobilization with that band. Okay, what we're going to do now is we're going to talk about the lengthening techniques or stretching techniques. So we're going to take that muscle that's been put in a shortened position and we're going to bring it back to its optimal length. So for muscles to produce the optimal amount of force around the joint, it has to be at the optimal length. Okay, and then what that's going to do is, again, that's going to stop those. That's going to help prevent those compensations from occurring. Okay, so what we're going to look at first, we're going to assume first of all that you had knees bow in. Okay, with the heel rise. So we need to mainly go after our hip flexors and those adductor muscles. So what I'm going to show you guys first is how to stretch out the hip flexor group. Okay, so we're mainly going to get the psoas and iliac as our primary hip flexors. They're all going to get stretched, but we're kind of really going to dial into those first. Remember, we can't release them because they sit deep to our abdominal muscles and kind of deep to our viscera. So you don't want to be shoving a ball or a foam roller in there. It's not going to be very nice. We're not going to hit it. Maybe if that needed to be done, you'd have to go see a manual therapist. I've done it. That technique is a little bit tricky to do, but definitely not something we can do at home. Okay, so we can't do anything for that, but we can release the TFL and rec fem and the adductors. So we're going to do what we can with what we got. So, but we can lengthen them. So what we're going to do, we're going to go into this kneeling position. Okay, so I'm going to bend my right leg to 90 degrees. Okay, I'm going to have my foot flat back on the ground, And all I'm going to do here, guys, when we're doing our lengthening or stretching techniques, we're only stretching muscles that we've assessed as short. That's one thing, okay? And what we're going to do, we're going to go to that first point of stretch. So to strengthen out lengthen out these hip flexors, I'm going to lean forward just a little bit. I'm going to squeeze my glute on the left because my glutes are the opposites to my hip flexors. If I squeeze them, it's going to help shut down and inhibit my hip flexors so that they're not so resistant when it goes to do this stretch. Helps to keep them calmed down, inhibited. So I'm going to lean forward, and I'm just going to that first point of stretch that I can feel in the front of my thigh or front of my hip, and I'm just going to hold it. So I'm only going to that first point of stretch, that first point of tension. I'm just going to hold it at that point, okay? And I'm going to keep it there for about 30 seconds to 2 minutes, or until I feel that tension start to go away and dissipate. A bit like the release techniques. We're just going to hold it. Again, 30 seconds to 2 minutes, because that's how long it takes for those muscles spindle. So when we do a stretch, we get an increase in tension. So those muscle spindles switch on. It's like a self-protective mechanism to stop us from ripping our muscles in half. But we're only going to the first point of stretch. We're not stretching hard. So it takes about 30 seconds to 2 minutes for our nervous system to tell that muscle spindle to calm down. I won't go through the full technical process because it takes a bit of time, but yeah, that's how long it takes. About 30 seconds to 2 minutes for our central nervous system to override that muscle spindle, tell it to calm down. And then what will happen then, we should feel, a reduction in tension, a reduction in discomfort. And ideally what I want you guys to do then is then go to the next point of stretch. So just go that little bit further, go to that next barrier, keep that glute tight, and you're just going to hold it there again, 30 seconds to 2 minutes. Repeat that process until you get that release, and then we can move on to our next stretch. So to show you from the side what it looks like, okay. So I'm in this position, so I'm going to slightly lean forward, just about here. So you'll notice that I'm actually in hip extension because my femur, so my thigh, is behind the midline. If I drew like a line, plumb line through my pelvis, from my hip joint, my femur is behind it, so that means I'm in extension. Now I've only got about 10 to 15 degrees roughly of hip extension. I don't have any more than that. If I go deep into it like this, a bit like that yoga pose, not that there's anything wrong with yoga, but if I go right into this deep kind of hip extended positions, I'm really putting a lot of stretch on those hip flexors. There's a couple of things going to happen. One, I don't have that range. I don't structurally have that range of motion. None of us do. So, but if I force that, I then have to compensate elsewhere. And then what happens is I have to go into that anterior pelvic tilt to make more space, which then means I then have to arch my lower back to get down there. But remember, I'm trying to get rid of that. So I don't want to do that. I'm trying to correct that. So if I just go back into here, I'm not fixing anything. I'm just going around in circles. So I'm just going to go to that first point of stretch, which is roughly about here. I'm going to keep that glute tight. I'm just going to hold it. I'm going to actually pull my belly button in as well. That also helps to shut down my lower back muscles, my hip flexors. I'm going to keep it there. So really, I want to keep my foot flat there. I'll keep putting up out of habit, but I'm going to keep my foot flat if I'm going to do my psoas and iliacus, so my main hip flexors in that position. But if I want to dial in to my rectus femoris, if I want to get into that a little bit more, if you feel like, you was working through this, that anterior pelvic tilt knees bowing was getting, a bit better, but not entirely. It might be that we need to dial into the other hip flexors. So if I want to get more into that rectus femoris, because it's a quadricep muscle, my quadriceps extend my leg, they basically make my leg straight. If I put my toes into the ground, I'm going to flex my knee a bit. That's going to help to stretch out that rectus femoris a little bit more. Still go to that first resistance barrier, squeeze my glute, and now I'm targeting, now you might feel that a little bit more lower down in your quadricep muscle, and then we're dialing into that one in particular. Okay, now again do my 30 seconds to 2 minutes, same thing. So that's for rectus femoris. If I want to get that TFL and gluteus minimus, those muscles on the front pocket area, so they play a big role in that knees bow in and that anterior pelvic tilt. Again, what I need to do there okay, is because those muscles, they rotate my femur inward this way, they actually kind of turn it in on itself. What I'm going to do is I'm just going to slide by my back leg outwards, so it's kind of behind my left leg, my left foot rather, is behind my right leg, my right foot. So what I've done is I've turned my femur, my thigh outwards. That's going to help to lengthen that TFL and glute min. And now I'm going to squeeze my glute at the same time. And now what I've done, I've just dialed in a bit more into those muscles. So maybe they're our problem. Maybe that's what needs to really be addressed. Maybe the others are okay. Maybe that's the one that I really need to get into. So I can then modify the stretch and do that. And again, 30 seconds to 2 minutes, keep that glute squeezed until I get that reduction in tension. And then I can go on to the next barrier. Cool. So that's for our hip flexors. That's our hip flexor stretches with modifications. Okay guys, so we did the hip flexor stretching. So the other muscles that we want to get into, if you had that knee bow in, anterior pelvic tilt, is the adductors. So those muscles on the inner thigh. So we did our release for those. Okay, so they also contribute to that problem. So what we're going to do for that, I'm just going to show you from behind, so I'm going to turn my back to you, is we're going to go up against the wall, okay? And we're going to take a wider than shoulder width stance. Okay, so a nice wide stance. And I'm going to do my left side, okay? So what I need to do there is I'm going to go and take my right foot forward. So now this leg is now in relative hip extension because my hip flexors, sorry, my adductors are also hip flexors. Okay, so if I go into this position, plus I'm in the wider position, I'm also going to lean away from that left side. So now I'm doing abduction, I'm doing the opposite of what the adductors do. And what I'm also going to do in this position, as I'm leaning towards my right side, I'm going to kind of push this right knee in towards that wall. I'm also going to squeeze that left glute because those adductors will cause that anterior tilt. So if I squeeze my glute, I do a posterior tilt, I tilt the pelvis back the other way. I'm going to squeeze that left glute, I'm going to hold it. And again, like the hip flexors, I'm going to go to that first point of stretch. And I'm just going to hold it right there, that first point of stretch, that first resistance barrier. Again, 30 seconds to 2 minutes, or until I feel that release. And then once that's done, I can go that a little bit further. Repeat the same process, 30 seconds to 2 minutes. Keep that glute tight, keep it switched on. Wait for that stretch to dissipate. And then I can change and do the other side. So that's for my adductors on the inside of my thigh. Okay guys, so we did hip flexors and we've done the adductors. What about if you do your overhead squat and you get that anterior pelvic tilt, so that increased lumbar curve, and you put your hands down and then it goes away? Well, that's a sign that it's not coming from the lumbo-pelvic hip. It's not those hip flexors and adductors that are really driving it. It's actually these big muscles on our back, which are our latissimus dorsi. So they're actually our largest muscle in the upper body, like these big kind of wing-shaped muscles here. So that's a sign that they're causing it, because what happens is where those latissimus dorsi muscles, they attach to the back of our pelvis. If they get short, they're going to pull the pelvis up this way. That's going to create that anterior pelvic tilt again. So if I'm going to lengthen them out, so hopefully if that is the case, if you identify that you release those muscles, okay, what we're going to do then, if once we've released it, we're then going to do our lengthening technique, okay, which is our child pose. So what we're going to do, we're going to try and sit back as far as we can. We're going to try and get our bum back to our heels. If we can't get our bum back to our heels, it doesn't matter. Don't worry too much about it. You just go to where you can go. That's fine. And then what I'm going to do, I'm going to reach my arms out as far as I can, and I'm going to let my head rest along the floor. I'm also going to turn, I'm going to come back a little bit so you guys can see, I'm going to turn my thumbs up to the ceiling because my latissimus dorsi, they rotate my arm, my shoulder joint inwards. So if I turn it outwards, it's going to help to stretch it a bit more. The reason I've got in that arm up position is again because they pull my arms down. So if I go in this position, it's going to bring them up, and also I'm in that that flexed position of my spine. I'm now actually rounding my spine, so that's also going to lengthen it. So I'm going to turn my thumbs up, sit back as far as I can. I can put a pillow under my head if I want to, or just rest my head on the ground. I'm going to reach up as high as I can. Go to that first point of stretch, and I'm just going to hold it 30 seconds to 2 minutes until that starts to calm down and dissipate. So I'm just going to hold it there, keep it still. Again, and then once I get that release, I can then just try and reach my arms up that little bit further, go to that next barrier, and again I can just hold it there again. Okay, so that's for my latissimus dorsi again. So I'll only really go after that one. Again, if you do that assessment, you add that anterior pelvic tilt, you put hands down, it almost magically goes away. That's what we want to do. The other thing as well is, what if it got a bit better, it didn't quite go away? Then maybe that's a sign that maybe it's the lats, it's coming from the upper body, it's the lats and it's the hip flexors. In that case, we would do both. We would do hip flexors, adductors, and lats. We'd get all of them going in together.